Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right 8, and the doctor has asked to check for remnants of the lower right 8 root fragments if there are present any. So, on the 3D rendering, we don't see anything major. On the panoramic view, we can see that the root tooth was extracted from the lower right segment. Now moving to the transaxial view, which is basically the proximal view, which show you each and every segment of this tooth. Now this is the lower right 8 region. The lower right 8 region, as you can very clearly see, is this is where the tooth was extracted, and this is the extraction socket. You can see that the buccal cortical plate is intact, where the lingual cortical plate, we can see the signs of damage is present. This is where the ramus starts, and you can see no root remnants can be majorly seen. We do see a few specks, which we will show you here, but no major fragments of the root can be observed. But we do see a slight speck here, which can be considered a fragment of the root, the tooth of that was extracted right there. This particular area we can assume, because of its radio opaque nature, that would be a remnant of the tooth that has been extracted. Here we can see two very significant things. We can see a perforation in the lingual cortical plate. We can see that the lingual cortical plate here is fractured, and this is where the fracture line is. So this is something that is to be noted. As we are as we are moving further distal, you can also again see a fracture in the lingual cortical plate, a fracture in the lingual cortical plate here, and this fracture is also leading, it could be a perforation in the lingual section, which could lead to pain, it could lead to bleeding, and it could lead to a hematoma formation lingually as well. So this is something that needs to be observed. As we move further distally, you can see that the tooth has been completely extracted. We don't see any major root remnant, we don't see any major tooth remnant, but we do, however, see a fracture in the lingual cortical plate that is observed here. And as we move further, you can see that this particular segment is separated from the lingual cortical plate and could be associated with any clinical symptoms that the doctor and the patient might have observed. We can show you this on the axial view as well. Axial view is the top to bottom view, which can be seen right here. And as we move further down, this is where the tooth has been extracted from. Again, no remnants can be observed. We zoom in for the doctor, and as we are moving down, you can see that we have a buccal cortical plate, we have a lingual cortical plate, and no particular problems can be seen. This is where we mentioned previously as well, in the other section, that there's a radio opaque section. This is where we can see, but this is very slight to cause any problems or discomfort to the patient. This is where the lingual cortical plate fracture can be seen right here, and then this extends slightly downwards as well. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.